My name is Sharon Derby. I'm a DNP nursing student from Augusta University, and I'm going to be doing an assessment today on your head, eyes, ears, nose, throat, and also too your skin and nails. How are you doing today?
Good.
Can you tell me your name and date of birth?
My name is Rachel Derby, and I was born on April 28th, 1999.
Okay, thank you, Rachel. So the first thing I'm going to do is I'm going to just check your skin. Rachel's skin is appropriate for her ethnic background. It's nice and warm even through my gloves. I don't see any bruising. I don't see any lacerations or any scratches or anything like that on her arm. And on her left arm, her skin is appropriate for her ethnic background. I see no bruises or lesions or excoriations or anything of that nature on her arm. And her skin is nice and warm even through my gloves. Let's take a look at your nails. Her nails are clean. They're pink. I can see that she has had manicures in the past because her fingernails are nicely shapen. Her capillary refill is brisk on her right hand. On her left hand, the capillary refill is brisk. Her fingernails are nice and pink, nicely formed and nicely shapen nails. Are you having any pain or tenderness in your hands?
No.
Okay. Let me just check your skin turner right up here. Skin turner is elastic. With pinching, it moves right back down to normal. Okay, Rachel, I'm going to also assess your head. And her head is, just by looking at her head before I touch it actually, her head is symmetrical. It's normocephalic. Let's check your skull and your scalp. I'm assessing for any bumps. Any tenderness, Rachel?
No.
I'm assessing for any lesions. I'm looking to see if there's any lesions. I see no lesions in your scalp. Her hair is brown and curly. It's evenly distributed on her scalp. Her scalp is nice and clean. And her hair is nice and clean as well, too. Okay. Next, Rachel, I'm going to be assessing your face. It's symmetrical and on both sides, and it's normal. Your head is normocephalic. I'm going to be assessing your neck, Rachel. Okay. I'm looking at your trachea. Your trachea is midline. On both sides, I don't see any lesions or any lacerations or anything like that on your neck and in your trachea. I'm going to be palpating your lymph nodes. These are your preauricular, your posterior auricular lymph nodes, your tonsillar lymph nodes, your submandibular lymph nodes, your submental lymph nodes, your anterior cervical lymph nodes, your posterior cervical lymph nodes, your supraclavicular lymph nodes. I'm not feeling anything, and then your occipital area too for lymph node enlargement. Don't feel anything there. I'm also going to be assessing your temporal mandibular joint. Rachel, can you I'm just going to palpate right here. Can you open your mouth? Okay, I don't feel any clicking. Can you close your mouth and clench down with your teeth? Okay, great. Any pain with your temporomandibular joint? Okay, great. Very good. So the next area, Rachel, that I'm going to palpate is your frontal sinus. Okay. Any pain here on your frontal sinus, Rachel?
No.
Okay. And how about here with your maxillary, your left maxillary sinus?
No.
Okay, how about here? Okay. We'll just do a little percussion. Your sinuses are air-filled unless you're sick and you have some type of an infection. Then your sinuses become congested with fluid. Okay. Next, Rachel, I'm going to be assessing your eyebrows. So your eyebrows the hair on your eyebrows is evenly distributed. There are no lesions noticed. There's no irritation noted to your eyebrows. Let's take off your glasses for 1 minute. Okay, and I'm going to do a couple tests with your eyeglasses off. Okay, and I'll give your glasses back to you in just a few minutes. Got all of these different things here to do. First of all, with your eyes, Rachel, I'm going to shine the light into your pupils because I want to see if there's constriction of your pupils. Great. Left pupil constricted really nicely. Right pupil constricted very nicely. I'm going to do a cover and an uncover test on your left eye. First of all, let's start off with your left eye. I'm just going to cover your left eye. Right eye does not move. Okay, I'm going to cover your right eye. Her left eye does not move, so her eyes are in good alignment. Both left and right are in good alignment. I also have it's a pocket-sized Snellen eye chart. I just want to explain to you what that means. So if I were going to assess your visual acuity, if you had 20/50 or 20/60 vision, what that means is that at 20 feet, you can see what a person with perfect vision could see at 60 feet. But you wear eyeglasses, so I'm sure that your eyeglasses are corrected for 20/20 vision. Okay, very good. And I'll put that back. And then also too, Rachel, I have my ophthalmoscope. I want to do an assessment of your eyes with my ophthalmoscope. Oh, you know, let's do another test. I'm going to do the cardinal fields of vision with my other light. Actually, I can use this light as well too. Okay. So I'm going to just have you follow the light with your eyes only. Actually, no, it might be actually easier to do that with my pen light, I think, instead of with my ophthalmoscope. Let's just take that pen light out. Okay, so just follow the pen light with your eyes only. Okay, and then try this light. Okay, great. All right. I'm looking at your eyelashes. Your eyelashes are nice and long. They're clean. I don't see any drainage coming from your eyes. I'm going to palpate up here to feel your lacrimal apparatus. This is where your lacrimal gland is. Any pain or tenderness there, Rachel? How about over here? Okay. And then let's take a look at the sclera. Inspecting your sclera, it's nice and white and clean. I don't see any redness or drainage coming from your eyes. The sclera is not reddened or irritated looking. Let's look at your conjunctiva. Your pink conjunctiva. There's no drainage, there's no lesions, there's no discharge, anything like that coming from your eyes. And then you've got a little lacrimal caruncle within the context of your eyes, and I see that, and it's nice and pink. There's no redness or there's no drainage noted. All right, great. I'm going to do my ophthalmoscope exam with you. So on the 0 diopter. All right. And just look straight ahead at me, Rachel, right here. Great, I see a nice red reflex, thank you. And over here. Great, I see a nice red reflex, thank you. Very good. You doing okay? Thank you for being so patient. Okay, I'm now going to check your nose, and then I'll check your ears, and that will conclude my assessment. But it'll take me a few minutes just to assess your nose. So inspecting your nose, I see that your nose is midline. There's no drainage. I'm just going to occlude one of your nostrils. Can you breathe in with your, there you go, good, great. I hear the sound of the air moving, so it's patent. How about here? Great, excellent, Rachel. So I'm going to take a look in your nostril with my light. Okay, great. So if you can just tilt your head back a little bit. Mucous membranes are nice and pink. They're moist. I can see, I'm going to just kind of insert just a little bit further. I can see your mucous membranes. I can see the turbinates, nice and pink. Pink. All right. And then now I also have, close your eyes for me, Rachel. I'd like you just to take a deep sniff of this that I'm going to just kind of put beneath your nose and just sniff and tell me what you smell.
Hand sanitizer.
Okay, yes, it's hand sanitizer. Okay. I've got my tuning fork here. I'm going to be checking your ears with my, you can open your eyes now, Rachel, sorry. I've got my tuning fork here. I'm going to just check your ears with my otoscope and my tuning fork. I'm going to be doing some checks of your hearing. Okay. Look at your ears. The auricle of Rachel's left ear is nice and pink, and it is. Turn my light off for a second. Do you have any tenderness or any pain or anything like that, Rachel? Okay, I see no drainage from her ears. Her earlobe is nice and elastic. The tragus is elastic. There's no drainage that I see, and she has no pain. I'm going to do an ear exam. I don't see any cerumen, but on entering the ear, I do see a little bit of cerumen, and I see a nice reflex, a nice white reflex. Okay, I'll go over here and check your right ear. The auricle is flexible, it's pink. Earlobe is elastic, the tragus is elastic, there's no drainage. Any tenderness, Rachel? Okay, let's take a look in. I do see some cerumen. And this tympanic membrane is a little hard to visualize. I'm able to see the other one a little bit better. But there's no drainage and there's no pain, right? Okay, great. So now I'm going to use my tuning fork and do some hearing tests on you, okay? All right. So what I'm going to do is I'm going to activate the tuning fork, and it's going to vibrate and make a sound. I'm going to put the tuning fork, first of all, on top of your head, and you tell me if you hear the sound better in your left ear, better in your right ear, or equally on both sides, okay?
Heard it better in my right ear.
You heard it better in your right ear. Okay, so then there may be some conductive hearing loss in your right ear that might need to be. It was in this ear you heard it better? Well, we might have to get that checked out by your doctor. Okay. And then I also have another test for you. It's the Rhine test. And what I'm going to do is activate the tuning fork. I'm going to put this tuning fork right over here on your mastoid bone. And when you no longer hear the sound, just let me know, and I'm going to turn it and face your ear. And then let me know when you no longer hear the sound when it's facing your ear. I'm going to do that on both sides, okay? Everything has to be done on both sides. All right, here we go.
Okay.
Okay, great. So the air conduction was greater and longer on Rachel's left side than the bone conduction. Thank you, Rachel. Now we're going to try your right ear. Let me just try it again, sorry. Okay, right here.
Okay.
Okay, so the air conduction was longer on both the left side and the right side, so that was great. And then my last test that I'm going to be doing, Rachel, is, the whisper test. And then we'll be getting close to completion. Okay, so here is, I'm going to be asking you just to repeat these letters and numbers, a series of letters and numbers to me, please, okay? I'm going to whisper these letters, and then you just repeat that to me. Okay.
Seven B4.
Okay, and then
2C8.
okay, very good. And I just remembered that I still need to look in your mouth because I have two things to check in your, actually several things to check in your mouth. Can you open for me, Ryan, please? Okay. You can look at your mouth, look at the mucous membranes in your mouth. Nice and pink and moist mucous membranes. And then the buccal mucosa is nice and pink. There are no lesions or edema noted. Your teeth are nice and clean, white. The hard palate is pink and intact. Can you stick out your tongue and say ah? Again. I can see her pharynx, it's pink and there's no exudate. Her tonsils are small. Her uvula is midline. Can you move your tongue from side to side? This assesses the hypoglossal cranial nerve. And how about on the roof of your mouth? Okay, great. Can you smile and show me your teeth and your gums? Nice and pink and clean. Great. Okay. And your lips are nice and pink and clean. There's no excoriations or anything of that nature. Okay. And that concludes my assessment. Thank you very much, Rachel.